anatomy, gross anatomy of eyelid. It consists of upper eyelid, lower eyelid, outer canthus, medial canthus or inner canthus. This is cornea, sclera, and plica semilunaris. Highly vascular, crescent shape, moon shape fold of conjunctiva. Sclera covered with conjunctiva, and the plica semilunaris is highly vascular crescent fold of conjunctiva. And then lacrimal cruncle. Lacrimal cruncle is modified skin with spacious gland and hair follicles also present, and this projection are projection like appearance is a lacrimal papilla. And lacrimal papilla have a hole which is called punctum, and this is the iris, pupil, lower eyelid, upper eyelid. This is sclera. The function of eyelid, it acts as a shutter. Which protect the eye from injury and excessive light by their closure. Unblinking spread of tear. Unblinking spread of tear over interior surface of the eyeball, and then drain into punctum and into nasolacrimal. Eyelid is divided into crease. Crease or sulcus present over upper eyelid and lower eyelid. Superior palpebral crease. Superior crease is formed by aponeurotic fibers of LPS, levator palpebral superioris aponeurotic fibers insertion into skin, which form the superior palpebral crease. This crease is very important. If patient have no crease, then any disorder in LPS which causes the ptosis of the eye, in congenital ptosis. In congenital ptosis, upper lid crease is absent. Lower lid crease is formed due to connective tissue between the orbicularis oculi muscles and skin. Orbicularis oculi muscles are present around the eyelid. Eyelid present in eyelid. When eyelid close, it cover the whole eyeball. When eyeball is open, when eyelid is open, it cover the upper margin of the cornea and lower lid just below the cornea. The distance between upper eyelid and lower eyelid. This is palpebral fissure height. The distance between upper eyelid and lower eyelid. Palpebral fissure height. The margin of eyelid 2 mm wide and 30 mm long. Upper eyelid have more hair follicles than lower eyelid. From superficial to the deep into eyelids. The outer layer of the lid is a skin. And then skin, orbicularis oculi muscles, palpebral portion, and marginal arterial arcades, sebaceous glands and the lid margins. Gland of Zeiss and moles होते हैं, from where originate eyelashes. This is a tarsal plate in which tarsal gland is present. Superior tarsal plate into upper eyelid, superior tarsal plate, and after tarsal plate, conjunctiva, palpebral part of the conjunctiva. Conjunctiva have a three part: bulbar conjunctiva, palpebral conjunctiva, fornix जो fornix palpebral conjunctiva after tarsal plate. Superficial skin. Superficially skin is present. Skin epidermis. Epidermis of the skin contain melanocytes and the lower epidermis contain sweat gland, sebaceous gland, thin, easily foldable, easily